bodies have a subtle way of telling us when something's wrong, and one of the most overlooked indicators of health lies right inside our mouths, the tongue. This fleshy, muscular organ doesn't just help us taste food, it can serve as a surprisingly accurate mirror of what's going on in the body. From vitamin deficiencies to serious illnesses, your tongue can reveal the first clues. Number 1, a white coating that won't go away. If your tongue looks like it's been dusted with flour or has a thick white layer that doesn't easily brush off, it may be a sign of oral thrush, a yeast infection caused by an overgrowth of candida. This often happens when your immune system is compromised or if you've been on antibiotics that disrupt the natural balance of bacteria in your mouth. It can also signal diabetes, especially if accompanied by a dry mouth. Number 2, bright red and shiny tongue. A tongue that appears unusually red and glossy could be a sign of a vitamin deficiency, most commonly B12 or iron. These nutrients are vital for maintaining healthy blood cells and nerves. A deficiency can cause inflammation and swelling, making the tongue look slick and swollen. If untreated, this can lead to more serious neurological symptoms. Number 3, deep cracks or fissures. A deeply grooved or fissured tongue may look concerning, but it's often harmless. However, when these cracks are accompanied by pain, burning, or sensitivity to spicy foods, or an autoimmune condition that attacks the glands responsible for producing saliva, dehydration, or a fungal infection can also make these fissures worse. Number 4, black or hairy appearance. A black, hairy-looking tongue might seem alarming, but it's usually caused by poor oral hygiene or smoking. The condition occurs when dead skin cells accumulate, allowing them to grow longer and trap food particles and bacteria. It can also result from excessive coffee or tea consumption or use of certain medications that dry the mouth. Number 5, pale or light-colored tongue. If your tongue appears unusually pale, it might be trying to tell you that you're anemic. Anemia caused by low levels of iron or B12 reduces the oxygen carrying capacity of your blood, which can lead to reduced blood flow to the tongue and a washed out appearance. This sign is especially concerning if you also feel fatigued or short of breath. Number 6, smooth tongue with no tiny bumps. A smooth, bald-looking tongue is sometimes referred to as atrophic glossitis. This condition occurs when the tiny bumps that give the tongue its texture shrink or disappear, often due to nutritional deficiencies such as iron, folic acid, or B vitamins. It can be accompanied by a burning sensation and increased sensitivity to hot or spicy foods. Number 7, swollen tongue. A tongue that looks swollen, puffy, or inflamed may indicate an allergic reaction, an infection, or an underlying health issue like hypothyroidism. Swelling can make speaking and eating difficult and should never be ignored, especially if it comes on suddenly, which could signal a life-threatening allergic reaction called anaphylaxis. Number 8, sore or tender tongue. If your tongue is sore without any visible injury or trauma, it could be a sign of a systemic issue. This kind of persistent discomfort is often linked to deficiency in iron, B12, or folate. In some cases, soreness can also be caused by stress-related behaviors like tongue biting or grinding. Number 9, small red or purple spots. Unexplained red or purple spots on your tongue might indicate broken blood vessels, often caused by trauma such as biting your tongue. However, in rare cases, they could be a sign of a blood disorder like thrombocytopenia or even leukemia. If the spots don't fade or are accompanied by other symptoms like bruising or bleeding, consult a healthcare provider immediately. Number 10, persistent ulcers or sores. Occasional canker sores are common and usually harmless, but if you have persistent, painful ulcers that don't heal within 2 weeks, it could be a sign of something more serious like oral cancer, Crohn's disease, or even a viral infection such as herpes simplex. Any sore that lingers warrants a professional evaluation. Number 11, burning sensation without obvious cause. Burning mouth syndrome is a perplexing and painful condition in which the tongue feels like it's burning despite no visible signs of irritation. It's often linked to menopause, anxiety, dry mouth, or neurological conditions. This condition can severely affect eating and speaking and often requires both medical and psychological evaluation. Number 12, yellow tongue. A yellow tongue might be an early sign of poor oral hygiene, but it could also suggest jaundice, a condition in which bilirubin builds up in the body, often due to liver dysfunction. While dietary factors like consuming yellow-colored foods can stain the tongue temporarily, a yellow tinge that persists should not be ignored. Number 13, blue tongue. A tongue that appears blue could be an indication of poor circulation or a lack of oxygen in the blood, possibly caused by respiratory or cardiovascular issues. Conditions like chronic bronchitis or heart failure can sometimes manifest first in the tongue. If your tongue changes color and you feel short of breath, seek medical help urgently. Number 14, dry, rough texture. A chronically dry tongue is uncomfortable and may signal dehydration or a condition like diabetes, which impairs your body's ability to produce saliva. It might also result from medications, radiation therapy, or autoimmune diseases. A dry tongue can crack, become sore, and lead to difficulties in swallowing and speaking. Number 15, white patches. If you notice white, lace-like patches that peel off or feel rough, it could be an oral inflammation condition of the mucous membranes. This condition can cause discomfort and even bleeding when eating spicy or acidic foods. It may be triggered by stress or allergies and sometimes coexists with other autoimmune diseases. Number 16, red rings or patches, geographic tongue. Geographic tongue causes red, smooth patches with white borders to appear and move around the surface of the tongue, almost like a map. While the condition is usually harmless and temporary, it may be linked to stress, allergies, or hormonal changes. Some people report mild burning or sensitivity when eating certain foods. Number 17, numbness or tingling sensation. A tongue that feels numb or tingly might be reacting to a dental procedure, but if it happens without explanation, it could point to nerve damage, a stroke, or multiple sclerosis. Vitamin B12 deficiency is another common culprit. Since the tongue is packed with nerves, any change in sensation should be taken seriously. Number 18, constant bad taste or metallic taste. Experiencing a strange taste that doesn't go away, especially a bitter or metallic one, can stem from various issues. These include infections, medication side effects, pregnancy, or even neurological conditions. A persistent bad taste may also point to oral infections, sinus problems, or digestive issues like acid reflux. Number 19, difficulty moving the tongue. If you suddenly find it hard to move your tongue properly or it seems stiff or uncoordinated, this might be due to nerve damage, stroke, or muscular disorder like ALS. Movement restriction can also occur in infants with a condition known as tongue tie, where the tissue connecting the tongue to the floor of the mouth is too short. Number 20, tongue tremors or involuntary movements. A trembling or quivering tongue might be subtle, but it can be a sign of neurological issues such as Parkinson's disease or essential tremor. This symptom may start gradually and worsen over time and should be evaluated if you notice shaking or lack of control while speaking or eating. Your tongue is more than a tool for tasting. It's a dynamic health monitor that reflects what's happening inside your body. From nutrient deficiencies to autoimmune conditions and even cancer, the signs it displays can help detect problems early. That's why it's important to regularly inspect your tongue and pay attention to any changes. While not every variation in appearance signals illness, persistent or unexplained changes should always be checked by a healthcare professional.